Good afternoon, everybody. My name is Tim Schultz. I'm from Business for South Africa, and thank you for joining us for this webinar today. We have a very packed program, so we're going to dive straight in. I will put up the agenda in a moment. The key thing is we're going to run through all the speakers, and then we will open up for a Q&A. You will have an opportunity to ask questions. You'll see there's a Q&A and a comment and a chat function. Please ask your questions there, and we will try and get to as many questions as possible. We are recording the session, and it will be available on the Business for South Africa website in a few hours, well, probably in about a day or so, and you'll be able to peruse it there at your leisure. It has been a momentous day today. We have launched the EVDS system. For the first time, millions of South Africans will be able to register and put themselves in line to ultimately receive a vaccine. We have a very distinguished panel who have joined us today, and just to introduce them very quickly, we're going to kick off with Martin Kingston, Chair of Business for South Africa. Then Stavros Nicolau will take us through the progress made in phase 1 healthcare vaccinations. Thereafter, we will look at the transition to phase 2 and scaling up our national vaccination capacity with Dr. Guni Gulab and Dr. Lungi Nyati. Professor Barry Jacobson thereafter will talk to us about the Johnson & Johnson phase 3 study, an area of concern, I'm sure, for all of us. Then we will get into the detail of the electronic vaccination system with Melanie Wolmerans. And thereafter, we will open for a Q&A session. We also have Roseanne Harris and Dr. Lwazi Manzi, who will be able to answer questions respectively about the Department of Health and also about financing and funding and the role of the medical aids. Without any further ado, let me pass over to Martin Kingston.
Thank you very much indeed, Timothy, and good afternoon, everybody. Thank you very much for the time that you're taking to attend. I'm going to try and limit my remarks because I think that there's a lot to get through, all of which is particularly interesting, I know, to you on this call today. But in particular, I'd like to single out, if I may, Melanie Wolmerans, who's launched the EVDS this morning, and many of you will have heard a very clear account, hopefully you heard it. It was certainly very clear of how to use it, and I know that she'll take us through that this afternoon. We've been now functioning as B4SA on the vaccination program for less than 4 months, but I have to say the level of cooperation that we're now experiencing with government as our lead partner in developing, designing, and then implementing the program, I think, is unprecedented, certainly in my experience over the past 25 years, and we'll elaborate upon that as we go through this. We are both, on the one hand, there to ensure that we have a coordinated and integrated response and indeed delivery mechanism for the vaccination program as a partner to government, and also to give them, wherever we can, technical and other forms of support. And we think it's critically important that we use every opportunity we can to have an aligned position in terms of not just the strategy of the rollout, but also that we're able to communicate effectively both back to our own constituencies and out to the South African population at large about developments as they occur. And we think that these webinars are one such opportunity so to do. If we can just put up the slide, Timothy, that I'll talk to very briefly. We met with the President, the Minister of Health and of Finance and their respective teams about 2.5 weeks ago, and we agreed on the need, particularly with them and then specifically with the Minister of Health, to implement a joint strategic oversight committee where effectively we have meshed the 5 key work streams on the left-hand side. So that's finance and funding flows, information and data management, the service delivery platforms, 3 of them that we'll hear about today, supply allocation and delivery, stakeholder engagement, communications and advocacy. As many of you will know, we have our own work stream leads for each of those work streams with subject matter experts, as did the government. What we've now done is made sure that, to all intents and purposes, we have meshed the work. That doesn't mean that as business We don't need to formulate our own position. But in the interest of ensuring that we can actually achieve the objective of commencing the phase 2 rollout in the middle of May, starting with the over 60s, that we have all of our systems that are ready and good to go. And the purpose of the Joint Strategic Oversight Committee, which is now meeting twice a week under the chairmanship of the Director General of Health, supported by the Director General of National Treasury, is that we can address any bottlenecks that arise in any and all of the work streams, and particularly, and there's only one agenda item, that we agree on an end-to-end critical path covering all of the work streams, so that we can understand the interdependencies, and that critical path, which is being co-developed effectively between ourselves and the National Department of Health, ultimately, of course, has to be owned by the National Department of Health as the implementing agency, not just for and on behalf of the government, but I have to say, for the country. And between that, there's now a cadence of meetings that is happening daily. I'd love to say during the week, but it is daily, 7 days a week now, to make sure that to the extent possible, we can address any of those constraints as they arise. There's a huge amount of work to be done. And I think, Timothy, that this gives everybody, or this session will give everybody a snapshot of some of the key work streams where we are in that process, and in particular to be able to leave enough time at the end for questions and answers. So with that, if I can thank you, Timothy, for having organized this with the rest of the communications team and hand over to Stavros.
Okay, Martin, thanks very much. Ladies and gentlemen, good afternoon. In the first instance, I'd like to join Martin in welcoming today's launch of the phase 2 registration on the EVDS system, which is initially aimed at those who are over 60 years of age. We'd also like to remind everyone on this call that government has asked beneficiaries who are 60 years or older to register from 4 p.m. today. So roughly in an hour's time, the EVDS system, online system, will become available for you to go and register online. This, of course, represents a significant development and a massive step forward in beginning to start touching, we begin to start touching and feeling the vaccine program for the general population. The opening of phase 2 registration will run concurrently with the phase 1A Sisonke trial, which is currently on pause, we know, and of course the phase 1B commercial allocation of vaccine doses. Phase 1, of course, covers the healthcare workers, and we aim to complete vaccination of healthcare workers during the month of May. This will mean that we would have vaccinated, hopefully, before the advent of a third wave, the onset of a third wave, we would have vaccinated the majority of our healthcare workers, who number approximately 1 million people. To date, we know that around 300,000 healthcare workers have been successfully vaccinated, and I'd therefore like to appeal to all healthcare workers who have not as yet registered on the EVDS system for them to be vaccinated, to do so on an urgent basis. We expect the vaccination program to ramp up significantly in the coming weeks as we move away from or out of the Sisonke implementation study, which of course, like all studies, takes longer to deploy because of the onerous study requirements associated with such study conditions. Put differently, we have been extremely restricted with the number of sites, vaccination sites, where healthcare workers could go and be vaccinated. And this will, of course, open up to several hundreds, if not thousands, of facilities as we move into phase 2. We also have 2 other significant vaccination acceleration elements in play. The first is the fact that we are moving swiftly to significantly increased capacity both around the private and the public sector vaccination sites. And secondly, the increased pace of delivery of vaccines into our country. This will allow us to ramp up the vaccination of the remaining healthcare workers, as I said, for completion during May 2021. Allow me next, colleagues, to briefly touch on where we are with vaccine deliveries and what the vaccine supply pipeline looks like. Firstly, we recognize that last Tuesday, 3 days ago, the Minister of Health announced that government had secured an additional 10 million doses of the Pfizer vaccine. Of course, this is a dual dose regimen and means that you would cover an additional 5 million lives with these 10 million doses that will now be received. This, of course, means that government has successfully secured just over 62 million vaccine doses to date. This includes 31 million J&J single-dose vaccines and 30 million Pfizer-BioNTech double-dose vaccines, which will arrive in our country over the course of the year. And of course, the remaining 1.5 million vaccines that constitute the 62 million will arrive under the COVAX initiative. Yesterday, or as recently as yesterday, our president also announced that we will be receiving Sinopharm and Sputnik 5 vaccines. Of course, both of these options are currently in for registration with SAHPRA. We have no further details, of course, on any delivery or supply schedules for these two options. According to the National Department of Health, the known timing for the delivery of vaccines currently stands as follows. I'd love to take you through this detail, but don't have the time. Some consolidated numbers. In Q2, we're expecting 5.6 million doses of Pfizer and around 3 million doses of J&J. Q3, we're expecting around 8.6 million doses of Pfizer and around 9.1 million doses of J&J. There is an additional allocation of around 5.3 million doses of J&J out of the AU platform that will be arriving in Q3. In the interest of time, I won't cover Q4 and beyond. This is just to give you a sense of what we can anticipate in the two critical quarters, being Q2 and Q3. As you know, ladies and gentlemen, on Tuesday, there was another development in that the Food and Drug Administration of the United States announced that it was pausing the rollout of the J&J vaccine purely on a precautionary basis after 6 vaccines recipients, vaccinees, out of a total of 7 million in the US developed a rare blood clot condition. In response, and shortly thereafter, our own Minister of Health, Dr. Zweli Mkhize, announced that South Africa will, on a voluntary basis, pause the rollout of the J&J vaccine through the Sesonke study in order to allow SAHPRA, our own drug regulatory agency, to assess the situation. As an unfortunate consequence, the phase 1A rollout of the Sesonke J&J implementation study has been paused momentarily. Minister Mkhize went on to stress that this was a precautionary and temporary measure and that no blood clotting adverse events had occurred in almost 300,000 recipients who received the vaccine in our own country under the Sesonke study. These types of reports, of course, are expected to emerge as part of a robust post-market surveillance system, which otherwise is known as a pharmacovigilance system, and should provide comfort to the public that the medical authorities keep a vigilant watch on all new products that are deployed into the market whether they are pharmaceuticals or vaccines, in order to ensure that they remain safe and effective for human consumption. And I certainly think we need to take that as a huge positive, that we do have these robust pharmacovigilance systems in place and do provide additional reassurance to the public. Shortly, you will hear from Professor Barry Jacobson, one of our countries and one of the world's foremost experts on thrombosis and hematology. He will talk us through the adverse events and how they are currently being considered in our country, and will address any questions you have in this regard. We know that vaccines which protect against serious illness, hospitalization, and death are the best way to protect lives and livelihoods during this pandemic. This is the intention between our country's COVID-19 vaccination program, and will continue to be the case, where we look to protect lives and livelihoods. With over 53,000 deaths caused by COVID-19 in our own country over the last 13 months, Business for South Africa believes that vaccines remain the safest and most effective instrument we have in combating the virus. I'm not for a minute minimizing the requirements for vigilance with respect to non-pharmaceutical interventions such as social distancing, hand sanitizing, masking up, etc. Lastly, may I say that for those that have concerns around either our capacity and capability to ramp up, or have concerns with vaccines in general, I should add that South Africa is no stranger to vaccines. We dispense and administer over 14 million vaccinations per year, mainly pediatric vaccinations, and this is to all parts of our country. Pre-COVID, the private sector also rolled out vaccines. For example, last year, 1.3 million flu vaccines were administered in a 4 to 6 week period for flu. So if you were to extrapolate that to 12 months, you can see how feasible the goal of vaccinating 250 to 300,000 vaccinees on a daily basis. It's very possible. I'm going to pause at this point and hand over to Professor Jacobson, but I should, before I do that, once again, thank our partners in government for the excellent collaboration. It's unprecedented, and it was demonstrated again this morning in the launch of the EVDS system. And long may it continue, and long may it be all shoulders to the wheel. Thanks very much. Over to you, Barry.
Thank you very much, Stavros.
In fact, I might have jumped the gun. Sorry, Tim. Is it over to Guni and Lungi first, or Barry? You make the decision.
To Guni and Lungi.
Okay, apologies, Barry.
Thanks, Martin and Stavros. And firstly, good afternoon to everybody. And let me also take the opportunity, firstly, to say that under the leadership of Martin, Stav, and the SteerCo, a whole cadre of volunteers have been working tirelessly to share with you what we're sharing today. And I want to acknowledge the work done by the service delivery work streams in delivering that. Also, as Timothy mentioned, today was a momentous day where the NDoH launched the EVDS system. And I had the opportunity at 7 o'clock also to watch. And Milani, congratulations from our side to you. I watched the demonstration end to end, and it was very impressive. Thank you very much. So I'm going to briefly share with you, picking up where Stavros left off, to say how are we going to scale up to deliver vaccines to our country in a single mass vaccination program against COVID for our country over the coming 9 to 12 months. I'm going to focus mainly on how is Business for South Africa working with business and healthcare organizations gearing up for the delivery of phase 2. And then I will be followed by Dr. Lungi Inyati, who will focus specifically on sector employer sites. Tim, can we go to the next slide, please? So in thinking through how we were going to set up for phase 2, we applied a very intuitive way of thinking about it. If you ask yourself typically where we live, and you say, where are healthcare facilities available where I live, then you would know that either you have your local pharmacy, your local GP, or a hospital nearby. So the first way that our service delivery platforms are operating is we're using traditional health sites to deliver vaccines through pharmacies, hospitals, and GP practices. I must add that the hospitals will be limited to a small number of hospitals that have already been part of phase 1, because a large part of their work as we head into the winter will be focused on combating the third wave that we're anticipating. All of the pharmacy groups, whether they are independent pharmacy groups under the ICPA banner or corporate pharmacies such as Clicks, Dis-Chem, etc., have all put up their hands to be part of the program, and all of them are part of the data that I'm going to share with you. All of these groups use their own resources that will be delivering the vaccines during this period. The leadership of this group is under Simon Strachan, Shem Mudley, Morgan Chetty, and Melanie DaCosta, supported from a strategic point of view by Adolf Machato. The second area, which Lungi will go into much more detail, is the sector employer side. So you ask yourself, where I work, is there a facility, a health facility, or a service where vaccines can be delivered? And so the sectors, for example, mining or corporate sites such as banking as examples, or organizations in the government, both national and local, or parastatals such as Eskom, Transnet, or SABC. And then thirdly, congregate settings such as frail care or care nursing homes are the second area that we're focusing on. And here there's two primary ways of delivery. Firstly, many of the workplaces have dedicated occupational healthcare services. And then secondly, many of these employer sites have medical aides and their administrators that deliver on-site health and wellness services, and these will be repurposed for vaccination. This is led by Dr. Lungi Inyati and supported from a strategic point of view by Dr. Brian Brink. And then the third service delivery platform that we're setting up is, you've seen this around the world, and this is pandemic specific. These are temporary large sites to deliver high throughput vaccinations at scale in the shortest possible time. And this will utilize space, places like stadiums, convention centers, community halls, etc. Here, the leadership is under Justin van Wyk and supported by Dr. Ron Whelan from a strategic point of view. Here, we're working very closely with the NDoH to ensure that we identify 10 extremely large sites in the eight major metropolitan areas, and these sites will largely use Pfizer vaccine to deliver high throughput. Timmy, we can go to the next slide. And I now want to pick up on the point both Martin and Stavros raised. You know, a key question has been asked, how will we scale up and deliver during phase 2? So what I want to take you through is that during phase 1, as Stavros mentioned, we've largely been running the Sisonke program. Initially, it was with 17 sites and now has been expanded to 50 sites. And on average, we've been delivering approximately 2,000 to 4,000 vaccinations per day. The highest single recorded day during the Sisonke program has been approximately 13,000 vaccinations. We're now moving into phase 1B, which is the remainder of the healthcare workers. And we have currently approximately 385 sites that are planned from a private sector point of view. And the throughput that will go through these sites in a 4 to 8 week period is approximately 48,000 vaccinations per day. So you can see a dramatic ramp up from phase 1A to 1B that we're anticipating. And then moving to phase 2, and phase 2, the first part, and it was announced today, phase 2A will be focusing on the elderly over 60. These are our most vulnerable and are at highest risk of mortality especially as we're heading to the winter period. Approximately 5.5 million people in our country. From a private sector point of view, we've currently confirmed 1,200 sites across pharmacies, hospitals, and GP practices. And we're working towards, as I indicated, also employer sites and mass vaccination sites. Our current anticipated capacity on our database is 115,000 vaccinations per day. And then we are in the process of procuring additional planned sites which have not yet registered. This will then be scaled up in conjunction with government into phase 2 and ultimately phase 3, reaching a peak of approximately 250,000 vaccinations per day at peak from September onwards. With that, I'm going to hand over to Dr. Lungi-Nyati. Thank you very much.
Thank you very much, Guni, and thank you everybody for joining us. I see that there are many people from the business sector here, and this is exciting for me because my job is to send out a plea to all of the business sector that is willing to support this national rollout for vaccination by considering to register your workplace as a site for vaccination of your employees. To a large degree, the healthcare sites, as mentioned by Guni, will form a backbone of the registration program. But if workplaces are able to vaccinate their employees in their workplace, we do give room to the community-based, the community sites for shorter queues and accelerated vaccination. If you can move to the next slide, Tim, please. So I just want to take a moment to go into a deep dive on employer sites in terms of the requirements for you to consider. This is not the most extensive list of information, but what is most pertinent. The first is in terms of business rules for setting up a master facility. There are very strict criteria and a checklist that needs to be met to be able to set up a master facility. And and these are the most pertinent ones. Firstly, to be able to be on the master facility list, you need to either be a pharmacy or linked to a pharmacy, have a permanent doctor that is working for you, whether on a contract basis or permanently employed, or linked to a doctor, or be a permanent occupational health site or linked to one. For these sites, because the vaccine is a Schedule 4 vaccine, which means it ordinarily would require prescription, one has to get a Section 22A permit to be able to administer the vaccine without such prescription. And the NDoH has facilitated an expedited electronic process by which people, individuals, or sites at organization level can get the Section 22A permit, and this is guided in part through the registration on the master facility list. A site should be able to maintain the cold chain and storage capacity required to be able to keep the vaccine. As Guni said, for the majority of sites that are especially in metro districts, the Pfizer vaccine is what will be used, and it's got a specific cold chain requirements, which I think many people thought were very onerous, but they're not onerous, but not everybody will be able to meet them. Then there's an ability to claim, which is required, as well as consideration about whether you have a permanent site or will be setting up a temporary fixed site in your workplace. So those are some of the key considerations that an organization needs to think about, and we help you see whether or not you meet those requirements. The second one relates to the size of the Pfizer vaccine itself. In the pack size of Pfizer, there are 1,170 doses. And once this pack has been thawed, it can only be kept in a fridge for 5 days. Because of this requirement, we are recommending that a site that is able to do 200 vaccinations per day be considered as a master facility. And to be able to do 200 vaccinations a day, you need about 7 vaccinators conservatively. This will make sure that there's limited waste of vaccine by enabling throughput. In order to be able to make this 200 vaccinations per day recommendation, we think that a site should have the ability to vaccinate 5,000 and maybe aim for 1,000 people. This means that you'll be able to vaccinate 2,000 per day for over a period of several weeks, which will make it worthwhile for you to be a site that's open. To be able to achieve 5,000 to 10,000, there are several ways that an employer could do so. Either your workforce is large enough to meet the 5,000 requirement on its own, so you could be vaccinating employees only, or you could be vaccinating employees plus the family members of your employees and community, and that will increase the size of your vaccination site. Alternatively, there are some vaccinations, like in the mines as an example, where one will set up a master site in one of their bigger mines, but then be also from their master site looking after their smaller satellite sites. In this case, the vaccination will more than likely be then delivered to the master facility site, and then this site will coordinate work through the satellite sites and ensure that even more employees are vaccinated, even if it's not in the one site. There's some special considerations that we've looked into for rural areas. Ideally, we think rural sites should be open to the community. That will enable a site to be able to vaccinate more people than the smaller rural sites typically. And we know that the Department of Health has indicated that preference will be given to rural areas for the J&J vaccine. This is to take into account that most rural sites tend to be smaller and the pack sizes for J&J are smaller. And secondly, the cold chain requirements are less stringent for J&J. And then lastly, it is often difficult in the rural areas for one to get back into the rural area for a second dose. And that's why the rural areas are being considered especially differently. So should your organization be able to meet these requirements or be able to invest in order to meet these requirements, the next thing that would be necessary for you to do is to submit a template for these workplace sites, and all sites that one is contemplating, we would recommend that you submit. In there, we're requesting GPS coordinates, the number of employees and or family that will be covered, what the nature of your cold chain abilities, whether you have a fridge or a freezer or both, and the number of vaccinators that you have. This will enable us, firstly, to understand whether you meet the requirements and be able to guide you to optimize in order to meet those requirements. But most importantly, it helps us understand both the demand and the supply that's available on an ongoing basis, so that we can know where sites are likely to be limited in any given area. Also, it helps us understand what the remaining requirements would be for alternative sites, depending on the number of workplace sites that are available. Thereafter, one has to go through the process of registering on the master facility list. Only sites that are registered on the master facility list will be able to be allocated employees or other members of the public for vaccination, and only sites that are registered on the master facility list can the distributor supply vaccine to. You then need to obtain a Section 22A permit for your organization and all the vaccinators that you'll be looking after and the satellite sites that you'll be looking after. And then you must ensure that the vaccinators that you will have go through the training and also get registered. The training is online, and I can provide the link at a later after this or on the chat. And having done all of those requirements, one has to do a lot of work to plan the logistics and the infrastructure that you require to make sure that you're set up and ready by the time we start phase 2, which is approximately in 3 weeks. If you do not meet the requirements of being a master facility site, there are several options that are available to you as an employer. The first one is that your employees can be vaccinated at the community sites. Nothing is wrong with that. They will be fully functional and be able to register your employees. The second option is to link your occupational health site or your potential employer site to an existing health site or to another permanent occupational health sites. In some of the rural areas, some of the farms have small sites with not many employees, and so they wouldn't be able to meet the requirement to be a master facility site, but they can partner with a local GP or a pharmacy in the area and be able to obtain vaccines through them and still run their occupational health sites. And then there are alternative solutions that are possible that we are exploring in different ways. Some sites, some employers are using the services of some mobile services who are linked to a master facility and provide mobile services into that workplace and vaccinate on that workplace without that workplace setting up a site. And in the retail space, for example, there's consideration about potentially setting up a site for all the retailers in a retail space to facilitate a bigger site and also to be able to vaccinate all of those employees at a time. So that, broadly speaking, is a deep dive in employer sites. We're available to assist you, and I will be able to send you those templates after this. Thank you, everybody. Back over to you, Timothy.
Thank you very much. Let me jump straight in and pass over to Professor Jacobson, who will speak to us about the J&J situation. Thank you, Lungi.
Well, good afternoon, everyone, and thank you, Timothy and Stavros, especially for inviting me to be part of this discussion. I think the purpose of my discussion is to actually try and stop the anti-vaccinators who are out there. What happened was this week, the report came out saying that there was this rare incidence of thrombosis in the veins of the brain and in the veins around the stomach that was caused by the J&J vaccine. There were two case reports, two papers that appeared in the New England Journal of Medicine. And what these represented, and I think it is causal, what that represents is a very rare condition where one develops an allergy against one's own platelets, and then you get activation of the platelets and thrombosis associated with low platelet counts, so-called vaccine-induced thrombotic thrombocytopenia. And this very rare condition occurs also with heparin, which is a drug we use as an anti-clotting drug. And we use heparin every day. And we accept that there's a very rare risk that it can paradoxically cause a clot, but we accept this risk. So while I appreciate the fact that as a study, the SAHPRA felt a necessity to pause it till they could get a little bit more information and see what to do. I think now they have all the relevant information and they need to stop this hold, because the risk is very, very, very rare. If we can put it into perspective, your risk of being struck by lightning is in the region of 1 in 500,000. Your risk of developing this particular form of clotting is in the region of 1 in 1,000,000. So you theoretically have to be struck by lightning twice to equate to this risk of getting this very rare cause of thrombosis. That's not to say other thromboses don't occur, but one needs to remember that COVID itself is a huge cause of thrombosis. And having worked on the front line and managed doctors who have died from thrombosis, I feel very strongly, if not passionately, that we need to get this hold off as soon as possible, what we have also done to try and alleviate SARPRA's fears is to draw up a guideline on how to identify this very rare group of patients and how to manage it. Through the society, we've developed this guideline, which we hope to get published sometime next week with international referees. And it's a cross-specialty guideline because our society is multidisciplinary. It's not limited to clinical hematologists. It has cardiologists, vascular surgeons, cardiac surgeons, neurologists, nephrologists, to name a few, intensivists and pulmonologists. So it's a cross-specialty document that we are educating doctors. I was on last night on a Zoom meeting to 1,000 doctors to try and educate them about this very, very rare complication. And my major concern is that these anti-vaccinologists who are saying it's a bad thing to vaccinate don't really appreciate that vaccines have altered our lives. They make us live, they improve both the quality and quantity of our lives. And COVID is an absolutely terrible disease, a really terrible disease. Having picked it up myself, because from working on the front line, I can tell you firsthand experience that it's not a fun disease to have. And having seen healthcare workers die, Stavros and I both feel passionately that we need to get our healthcare workers protected as soon as possible. And that while we understand, you see, in America with the FDA, they've got alternatives they can go to. We don't have any alternatives to go to. So the scientific basis for maintaining this hold is very tenuous, if feasible at all. And I think that we have that the organizers of Sisonke have been trying to address all SARPRA's concerns as soon as possible, and that we would like to make sure that SARPRA lifts this ban as soon as possible. I'm happy to answer any questions. I think this is very different from other thromboses. So I've had a fortune of my patients who phone me on a regular basis now and say, listen, I don't want to be vaccinated because I'm at risk of getting a clot. Well, the answer is you at least 100 times more likely to get a clot from COVID than you are to get from the vaccination. And if you're worried about clots, then get vaccinated, because your chance of getting a clot is much worse if you get COVID. So my plea out there is to get the public aware that this is a storm in a teacup, and that we need to get our vaccination programs up and running as soon as possible, and that J&J so far has turned out to be a very good vaccine, single dose, effective against our variant. And I would like to make sure that our healthcare workers, who are the most people who are the highest risk, are brought back into the fold, and our vaccination resumes as soon as possible. Thank you.
Thank you very much, Professor. We're going to go straight on to Milani, and thereafter we will have a panel discussion, and we will try and deal with as many of the questions that you have placed in the chat or in the Q&A as we can. Milani, let me hand over to you. Milani, you're still on mute.
Thank you very much, and thank you for the opportunity to, first of all, for the invitation, and secondly, for the opportunity to share with you just an overview of the official South African vaccination registration portal. Before I start the presentation, I would just like to say, first of all, we appreciate all the acknowledgement, but I also would like to thank the leadership from the Minister, the Deputy Minister, the Director General, all my colleagues at the National Department of Health, our colleagues in B4SA, and then the remarkable development team that I'm working with that has literally put in days and nights to be able to deliver. So this is really a collective effort that I think we can all celebrate together. If you could just give me an opportunity to just get to the website.
Milani, your camera is off as well, so we're unable to see you.
You want to see me?
Oh, we were famous on TV earlier.
Okay, so I just want to get onto the website. I'm sorry, I was trying to answer questions and so on. So I think I failed a little bit to multitask. So if you just could give me 1 second. And this is now Murphy's Law.
While
So-
Milani's looking for the website, you'll see we put the link to the master facilities list on the chat.
Okay, ready to go. So apologies for the little bit of a delay. First of all, the registration portal or the pre-registration of anybody that would like to be vaccinated forms an exceptionally important input into the whole vaccination program. It allows us to plan appropriately. It allows us to streamline processes. It allows us to ensure that the appropriate number of vaccines is available. And then ultimately what it also provides us, it provides us with a communication platform. It's possible for us to communicate with people. Like for an example, I'm just using it as an example now with the Sisonke program, when we had, there was almost 5,000 healthcare workers that were scheduled for their vaccination. And when it was paused, we could immediately send them a message to inform them about that so that they don't pitch up at the vaccination station or site as it has been scheduled. And I don't foresee that these type of things is going to happen into the future. We just need to stay positive. But all I'm trying to indicate is that it allows us also to communicate with the population that has been registered as the vaccination program is unfolding. I think it's also important that we give reassurance in terms of that we as the government, the National Department of Health is the owner of this system. And we as the National Department of Health are taking responsibility to protect everybody's personal information. And we have put everything a measure in place to ensure that the information are securely stored and that it is not being, that there's no unauthorized sharing of information. The system is stable, the system is solid. We've tested it, we've run every single possible test that we could. Just with regards to the registration system, it can accommodate 3,000 registrations per second. And I think that's remarkable. We do have additional production servers on standby, and it's possible to move to double that if it should require. There's a lot of back-end information or analysis that's happening at the end. It's supported by a very robust geospatial analytics platform so that we can ensure that we can assign anybody that has registered to their closest vaccination site. And then this information also allows us to streamline the processes at the vaccination site. Because what it allows you is that you don't have to complete forms and ensuring that a consent form has been signed and that there's a copy of the ID and so forth, because we are digitizing the process and therefore focusing on the vaccination and ensuring that we can vaccinate according to the throughput of the facilities. I'm going to pause there just to indicate, so those are basic things that I wanted to say. So we kept the URL for this portal the same as the one for the healthcare workers. This doesn't mean that it now becomes one database. There's still in the back end a database for healthcare workers so that we can complete 1B, and we know that we have completed 1B of all healthcare workers that has registered. As it stands of today, we've got 850,000 healthcare workers that has been registered for vaccination, of which we have vaccinated just over 291,000 through the Sisonke program. So we kept this URL similar, just because it has already been socialized in communities, and a lot of effort has went in order to, during the communications, to ensure that people, and it's sort of nice on the tongue as well, vaccine.enroll.health.gov.za, then to try and get a new URL. This is the landing page. And it just gives 3 key bullets here to say vaccination is voluntary. Everyone who registers will be offered the vaccination. There's a confirmation that everybody will be vaccinated. And we will start with the people 60 years and older. And then with all of us working together, we'll move down the age groups as quickly as we can. And then when it's your turn, you will receive an SMS with the date, time, and place for your vaccination. So the first question is, are you a healthcare worker? If you would have said yes here, it will take you to the portal for the healthcare worker so that you can then register as a healthcare worker. For the purposes of this, I'm going to say no, but I will indicate that I'm older than 60. And register for vaccination. We currently have 3 forms of identity information, the South African ID, and then a passport for anybody that is working currently in the country or staying for a period in the country that's from another country. So this is for a foreign passport, and then making provision for asylum seekers and refugee numbers. So I'm going to use an ID number, and okay, we were asked to make sure that that individuals confirm their ID, so that we can make sure that there hasn't been a slip of the finger and they type it in wrongly. And then it will indicate to me that the 2 numbers are not matching, and then I can just correct it. Okay, it should be fine now. Okay, where did I make the mistake? That's right, it should be fine now. The system calculates the date of birth automatically from the ID number. I would complete the name, surname, and as part of the demographic details, we include gender. And then at the bottom, we ask individuals that register, that want to receive the vaccination, just to confirm that the information is correct. This is information that will be digitally pulled into the system so that we limit, like I said, paper-based forms, or a lot of capturing that needs to happen at the vaccination site. And if the data is pulled into the main EVDS at the vaccination site, then it just needs to be confirmed by the individual to say, yes, my details is correct. We will go to the next step. This is very important. This is the mobile number. And if people are using mobile numbers or use a mobile number of a friend or a family member, like I indicated, this is a way for us to communicate with individuals that has opted in to receive the vaccine. I'll just repeat it again. Again, we've been asked to make sure that that the person type it in twice, so that we can deal with the possible finger slips and typing in the wrong number. Email address is optional, you can provide it. Then we spend a lot of time on designing this. And this is particularly because we know that in South Africa, there are communities that does not have and it makes it very difficult then to say where and how will we assign a vaccination site or make sure that the vaccination site is available to where there is a concentration of individuals that has been registered on the system. Initially, we thought, let's use postal code. And then postal codes also then was that some people won't know their postal code because it's not something that they use often. But it also was a situation where postal codes, it can be a very large area. And we then started working with different data sets, and we got to a data set that we have then programmed into this. So the first selection is just to select your province. I will choose Mpumalanga because I know Mpumalanga very well. And then I will go, and then you will choose a municipality. Almost everybody in the country knows their local municipality. We found that people not necessarily know their district municipality, but almost everybody, based on our research, know what their local municipality is. You will then select a local municipality, and then, so these are all the local municipalities in Mpumalanga. I can choose any one of them. So let me choose around the Shongwe area, Malala. Okay, and then you can choose a city or a town that is in the Nkomazi local municipality. So I can choose anyone. There's Marloth Park, which is close to the Kruger National Park. There's Komatipoort, which is just before you cross the border to Mozambique. And I want to choose one specifically. And sorry, I'll choose KwaMhlushwa. And then we also went into a suburb. So in the cities or in the towns, it will give you a suburb, but it also covers rural villages. And KwaMhlushwa is a village within Nkomazi area. And then you have typing in a residential address is optional. It's a choice if you would like to enter your residential address. What we also found from the healthcare workers is that a lot of free texts are being put in, and not everybody structure the free text in a certain way, which means that you need to actually apply quite a lot of technology in order to decipher this. And for the purposes of why we're collecting this information, up to a suburb, village, and a area, it's sufficient to be able to assign a person to a vaccination site. Then there's a question, do you want to get vaccinated at the vaccination site close to where you live? You can answer yes or no. If you answer no, then you'll go through the same selection process to be able to then select a site closer to where you want to. I had a call earlier this morning based on the demonstration where somebody was saying there's an older person, older than 60 years, that is staying in Pretoria, but she says when she gets her vaccination, she want to get it while she's with her son, because she wants to be there with her son because he will take her to the vaccination site. And then you can choose the address of the son so that then she's assigned to that closest vaccination site. And in this specific case, it was in another province and not in the same province where she's currently living. And that's just a practical example that I had to give some information to in the morning. I'm just going to, for the purposes of the demonstration, I'll click yes. And then there's just the basic to say, do you want to be vaccinated on a weekday or a weekend, and in the morning or the afternoon? And let's say morning, and then next step. Then is the medical aid information where we give them information. We found with the healthcare workers that because we didn't have this information, there was the perception that the medical, that the vaccination, the expenditure around the vaccination and the service will come from their savings or from their day-to-day benefits. And therefore people were hesitant to give their medical aid details. And that's why we make it explicit here to say that it will not influence any benefits. And we remove the statement that says prescribed minimum benefit, just because it's not a term that is that is commonly or socialized among people understand these type of terms because they are managing this. Do you belong to a medical aid? Yes. And then these are the list of medical aid schemes. I just want to check one. Yeah, we got an email this morning indicating that we left out the Pick and Pay medical aid scheme. So I'm just confirming it's back. And then 1, 2, 3, 4, 5, 6. And then next step, then you confirm that your details is correct, confirm that. You can go on to the terms and conditions. It tells you exactly the whole EVDS system, not only the registration system, so that people are well aware what we are using the data for. You will click that and then say submit registration. And then there's just this details. We will replace this or add also a section to indicate what exactly will happen at the vaccination site, so that we automatically give people more information, and we further capitalize on having the self-registration system as a tool for communication. Into the future, we most probably will release another version 2 weeks from now. The intention is to translate it in at least 2 more of the official languages. And we are working on a web WhatsApp platform. And there's also a possibility to move to a USSD platform for analog phones. And we're currently proofreading the user manual, which will be available soon. We will translate the user manual in most of the official languages in the country. And yes, this is how far we are. Thank you very much for the opportunity for sharing this with you. Thank you.
Thank you very much, Melanie. While the rest of the panel unmute, get ready to answer questions. We do have a large number of questions, Melanie. I'm just going to direct a few to you already. We've had about 400 people on the chat, and I think 400 participants rather, many of whom seem to have asked questions. I'm going to ask a number in a job lot, and if you could just answer those as we go. Firstly, how is it possible for a person to verify the EVDS information that they've inputted? Secondly, and I know you've answered it on the chat, people want to know what happens to people who've registered before 4 p.m. today. A third question is just about the site testing and the site capacity. I know you've mentioned that, but there's a number of questions about site testing and capacity. And then lastly, if you are a healthcare worker who's a registered healthcare worker who's over 60, do you go through the healthcare worker program? Do you come through the site? And that echoes some other questions asked by people who are healthcare workers who've registered through the site, but do they now register again, or do they just wait? Melanie, if you could answer those, and that would be helpful.
Sorry. The first one is just about the, let me start with the capacity. Like I've indicated, this specific solution, I have indicated that it's running, can run at 3,000 registrations per second, not per minute, per second. And we do have additional production capacity in order to move it up. Those that has registered this morning, we did the same when we did the healthcare worker registration. It is almost like a live beta testing where we're looking at the traffic, we're looking at how long people take to register so that we can see if there's any improvements that needs to be made and so on. When we say that we are switching it on at 4 o'clock, is only then that we will confirm people's registration. And the indication to everybody is if they don't receive a confirmation registration within 12 hours, these ones that has now started registering, then they just need to re-register again, because officially it only opens at 4 o'clock this afternoon. Can you just remind me of the other one, please, Timothy? My apologies.
About if people have registered already as healthcare workers, or if they're in multiple categories.
Yeah, so healthcare workers should register with healthcare workers because they will be, they follow the vaccination program of healthcare workers. Those and that's the recommendation. So healthcare workers should register with healthcare workers and register on the healthcare worker portal. And then this one is specifically for the general public. And that's the recommendation. And that's what we also are continuing to communicate with everybody.
Thanks very much. We've got Roseanne Harris here. There's a couple of questions about medical aids and if you've got a hospital plan and so on. Could you please run us through just the role of medical aids and how that will affect you as a potential vaccinee?
Thanks, Timothy, and good afternoon, everyone. Yes, so the process should be seamless as to whether you have a medical aid or not, in terms of certainly in terms of the registration, as Melani's demonstrated, important just to declare your medical scheme status, because that will facilitate what is happening behind the scenes. But in terms of the experience of individuals, in terms of having to fund, no one should have to be paying for the vaccine. So if you're a medical scheme member, it will be covered in full. Melani's mentioned that the term prescribed minimum benefits is not something that's familiar to everyone, but essentially it means that it is a requirement that every medical scheme benefit option, regardless of whether it is a hospital plan or a comprehensive option, is required to cover the prescribed minimum benefits in full. And so the vaccine is included under those benefits. And so the vaccine and the cost of administering the vaccine will be covered by the medical schemes.
Thank you very much. Lungi, there's a number of questions that I think between you and Guni you'll be able to answer. I'm going to read them out, and I ask for everyone's indulgence. I'm compressing a number of questions here. The first is about mobile clinics. Are they able to get the Section 22A permit? Secondly, what about companies that want to have a site but that aren't pharmacies, that don't have doctors, that got no health facilities at the moment? And then thirdly, what sort of quality control and inspections will be conducted on vaccination sites?
I don't know if Guni is deferring to me or I'm waiting for him. But the short answer is a mobile health service is able to get a Section 22A15 permit. However, they will not be able to have access to a vaccine because they will not be registered on their own on the master facility list. So they will be able to vaccinate, however, as part of a service extension from a registered facility. Then in terms of quality control, there will be a curator for occupational health sites. We're waiting just for confirmation on who that is, but they will be curated. And then the last question was about quality control. I'm just now trying to remember.
It was quality call. Well, what sort of inspection regime?
Oh, right. That was the curation. So inspection regime relates to curation. And then the other question was about if you're a site that cannot, that doesn't have your option are either your employees can go to a general health site, so a GP, pharmacy, mass vaccination site, or a travel clinic, or you can link with an existing health establishment and request them to almost be your oversight, and then you'd be run as a service from there, because they would be the ones that are able to receive vaccine.
Thank you. Stavros, I know you have to go very soon. Are there any questions that you've seen on the chat or that you would like to answer before you leave us?
Tim, I think I'm going to leave you in the capable hands of others, who I think, most of the areas I would have covered can probably be comfortably handled by Guni and Martin.
Okay, great.
Great. Thanks very much.
Thank you very much, Stavros. Melanie, there's a number of questions for you, and I know you've touched on some of this already, but if I may, if we can just revisit. What happens if you register twice is one of the questions. What happens if you've registered before as a healthcare worker and you haven't received a voucher, must you re-register? Perhaps if you could deal with anything to do with registrations that then don't flow, where you don't get instructions soon thereafter. Will we overload the system, or should people just be patient? What should they do? I'm afraid I think we've lost Melanie there. Let's move on if we can. There will be a lot of information about the EVDS site on the COVID-19 site. As you would have seen, it's only just launched, and there's going to be a large communications campaign from government to explain the EVDS site in multiple languages, as well as, and I see there's been some questions on this about how people can be assisted to register for the EVDS site if they don't have smartphones or computer access. There will be registration sites that can be used to assist people who don't have access to the technology, and there will also be people going into the communities to register people in the over 60s category, and then subsequently, of course, as the eligibility increases to younger vaccinees. So I'm just going to have a look here. Guni, perhaps you can answer a question, about private sector employees that are not medical or pharmacists and have registered already, for instance, the mining sector. So I think there's the discussion about not just age, but also about certain categories of worker. I know people have been registering in anticipation of that. Are you able to give us a little clarity on that, please?
Thank you. So I think the starting point for everybody is to be registered on the EVDS system. So all South Africans must use the EVDS as the entry point. Then employers can assist their employees through the process. In terms of vaccination sites, a number of the mining sectors will be part of vaccine sites as sector employer sites. And then the claiming process around this is in line with what Roseanne has mentioned, is that those that are on medical aid will be claimed via the medical aid process. And then we are aware of a number of employer groups that are indicating their willingness to fund the vaccination of their employees as well.
Thank you. Good. I know we're getting to the end of the session. I know there's still a number of questions that we haven't been able to get to. Roseanne, there's a question or two about medical schemes, if you will indulge us just for a few more minutes. do we know how the flow of funds will work? So how the billing of medical schemes will translate into payment back to the DOH if the vaccine sites are claiming directly and not procuring the vaccines. So perhaps something just on the funding, what can be confirmed at this point?
So the details of the funding flows are still being confirmed, but the funding flows will vary across different kinds of sites. As far as possible, the funding flows will make use of the existing claiming mechanisms. So, for example, private sector pharmacy sites would be using the existing claiming mechanisms for the claims from the medical schemes, and also in terms of the way in which they are acquiring the vaccines. Where you have sort of new dedicated vaccination sites, then the payment and funding flows for those sites will be slightly different. But essentially, as you said, ultimately the funding flows are that the cost of the vaccines themselves will be flowing back to the National Revenue Fund, and the vaccination fee, the administration fee, will be paid to the vaccination site. Does that answer that question?
I think so, yes, to the degree that can be answered at the moment.
Yes.
Lastly, I think we're going to have to wrap up here. There will be a lot more information. I understand there are still a lot of questions about the whole vaccination program. We will, as Business for South Africa, be doing further briefings and webinars every week or two as the information becomes available, and the national government will be doing the same to answer many of the technical questions that have been asked here, especially around the EVDS system. Perhaps if we could just answer one more question, Guni, and I think perhaps you're the best one to do it, and Lungi, actually no, Lungi as well. Just if we could run through once again what sites would be eligible to be vaccination sites. So there's a number of questions that in one way or another touch on this. Clearly from my reading of the questions, they are companies that have facilities that might have spoken hub business models, but which aren't at the moment providing healthcare services, but from what I can read, might have large numbers of employees. Just again, their eligibility for that.
Guni, am I doing this?
You go ahead. I'll come in if you leave anything out, but I'm sure you'll do fine. Thank you.
Thank you. So there's a difference, I suppose, between a site that is a master facility. So to be a master facility, you need to be broadly a health establishment. So you need to be able to receive vaccine. You need to have a storage capacity. You need to have a Section 2A5 permit. You need to have you need to be a pharmacy, GP, so a health site, as it were, or an occupational health site, permanent one, etc. So only those sites can receive the vaccine. However, those sites can be linked to satellite services, other sites, who will receive vaccine from there and register and then be able to vaccinate from that site. So an occupational health site that does not meet the requirement to be a master facility can still vaccinate on its site. However, it has to be linked with a master facility. So it is for occupational health. So it is for mobile services. You must be linked to a master facility site, and then you'll be able to receive vaccine from there, but vaccinate off-site from that master facility. I hope that clarifies.
Tell me if I can come in.
Yes,
yeah,
please.
So Lungi's covered it, but the only point I want to make is that the primary health site, the responsible person there, for example, if it's a pharmacy, the responsible pharmacist, that satellite site is under the supervision of that responsible pharmacist. Thank you.
Thank you very much, Guni, Lungi, Rosianna, and